the city.
Summer is coming, and not only will temperatures soon be heating up, but as we get closer to this year's midterm elections, public debate is sure to reach the boiling point in no time. When it does, the NCPA is uniquely positioned to lead the public policy debate. The primary point of contention, the Affordable Care Act, otherwise known as Obamacare, and the shattered promises that sold it. Promises like, if you like your doctor, you can keep him. Your premiums won't go up. If you like your health insurance, you can keep it. And even the question of whether the program can succeed. John Goodman answered that question for Fox News.
I don't think so. If we ask how many people who were previously uninsured are now insured, it's probably only 1 or 2 million. Out of 50 million uninsured, that's not a very good batting average.
In fact, NCPA senior fellow John Graham told The Blaze that enrollee figures for healthcare.gov are actually a negative indicator of Obamacare's success.
They've got about 25% of the people who have enrolled are in that 20-something age bracket. You needed about 40% to make it actuarially effective according to the premiums that the insurers put in there. And they can't massage this. I mean, insurers have to receive premiums from these people and then start paying their medical claims. If you look at state by state, look at all the money they spent on selling and promoting and marketing Obamacare. It cost about $40,000, $50,000, or $60,000 per enrollee to sign these people up, paying off the community organizers and union organizers to go out and sign these people up. So this is a big failure.
And on the anniversary of the Act's passage, NCPA senior fellow Devin Herrick said that premiums will increase substantially.
At its core, all insurance is a transferring of risk. Let's say I don't want to run the risk of paying a medical bill that I cannot afford, so I get insurance. Well, the Obamacare basically is telling me the type of insurance I have to have. It's telling me the type of insurance my employer has to offer, and those limits are a lot higher than most insurance, or virtually all insurance was in the past. There can be no limits. So to the extent the administration has increased the risk of insuring me, of course it increased the price.
The core problem is twofold: perverse incentives and an impossible mandate.
Healthcare is growing at twice the rate of growth of our income, and so now you have a requirement to buy something that's going to take more and more of the family budget, and over time the help we get from government is going to get smaller and smaller. The insurance companies face very perverse incentives. In the exchanges, there's a race to the bottom. They're going for very narrow networks which leave out the best doctors and the best hospitals because they're trying to get the price down because they think that healthy people buy on price, only sick people care about networks, and they don't want to attract sick people.
So can we transition from Obamacare to a better system? The answers are simple but not easy. And as usual for misguided top-down government policies, the NCPA has sound market-based solutions.
Choice. You should choose your own plan that meets your needs, your family needs, not the government. Fairness. We should treat everybody the same. Whatever assistance the government is going to give us, there shouldn't be thousands of dollars of difference for people at the same income level. Pro-jobs. We ought to get rid of everything in Obamacare which encourages your employer to fire you or downgrade your hours of work. Simplicity. Everything in healthcare.gov that's more complicated than eHealth, which is a private online exchange. Everything more complicated than that goes away.
The NCPA's core policy solutions were first presented in John Goodman's book, Priceless. His new book, Living with Obamacare, A Consumer's Guide, will soon be in bookstores in every major U.S. airport and available by ebook. In addition, NCPA healthcare reforms will soon provide the core of new legislation on Capitol Hill.
What's there right now is very inadequate, and so I'm working with some members of Congress on a more comprehensive alternative to Obamacare, and we'll put it up at a website, and people can go and compare Obamacare to the more conservative plan and make their choice.
And on top of all these problems are the taxes that will be necessary to pay for these failed policies. To better address the issue of tax reform, the NCPA created the Tax Analysis Center. The center's director is Boston University economist and NCPA senior fellow Larry Kotlikoff. And at a recent Capitol Hill briefing about reforming the corporate income tax, Bill Beach, chief economist for the U.S. Senate Budget Committee, applauded the NCPA's efforts to apply dynamic economic analysis to evaluate tax reform proposals.
I am so happy that NCPA, John Goodman,
and Larry Kotlikoff and hopefully Alan Auerbach are together on the Tax Analysis Center. Too long have we been drug around this town by the Tax Policy Center that does not use dynamics, does not use an economic model, and yet seems to have pretty much a monopoly on what is and what is not good tax policy.
The Tax Analysis Center already boasts a state tax calculator, showing for the first time the lifetime impact of moving from one state to another. And the center's first publication showed that a more broadly based corporate tax rate of 9% would increase wages for all workers, increase GDP, and still produce just as much revenue. The paper was featured in Dr. Kotlikoff's editorial in the New York Times. Finally, further frustrating the opportunity to solve these problems is a stumbling and lackluster economy, and it is likely to stay that way for a while. NCPA Distinguished Fellow Bob McTeer told CNBC's Larry Kudlow, "We shouldn't expect to see the Fed allowing interest rates to rise anytime soon."
It's not a big deal. It's just something new, part of Ben Bernanke's transparency that they've started doing that. But they're going to change their mind at every meeting based on incoming information. Right. Nobody's going to stick with where they put the dot a year ago.
So no one's going to know. No one up here is going to know. It's going to be the great guessing game.
Right.
The NCPA, focusing on solutions, while others, especially those inside the Beltway, focus on politics. That's more than being just a think tank. It's being an action tank. And none of these solutions would have been possible without your generous and continued support. Thank you.